name's Harvey Olivia. I'm a clinical instructor at Carrington College. I have the respiratory guy with me, Mr. Houston, doing the video. And we are going to make the first video for our lab competencies. This one is physical assessment. So before you enter a patient's room, it's very important for you to check what type of isolation. Before you even knock, before you go in the room, you want to do the proper PEE. So you might have one that is contact precautions, and you will see on here that it's telling you to wash your hands, use gloves, a gown, and different hospitals will have different types of precautions. Some of them are hybrids where they might do 1, 2, or 3 as well. This one happens to be airborne precaution. So this one you have to use N95, you have to use a gown, or you can use a PAPR, and you also have to use gloves and protect yourself. You can use goggles too if you choose. But each hospital has the signs, and they will put them outside the room, and then those signs will tell you what you need to put on. And then you can also put extra things on. So for instance, if it was just contact and you didn't need to put goggles, but you wanted to put goggles, you're welcome to put goggles. This is aerosol precautions. So it's going to tell you what you can do. There should be a door closed. It should be negative, also with the airborne as well too. So negative pressure. You've got droplet precautions. So this droplet precaution, you want a mask, you want gloves, and you want a gown and goggles or glasses. Okay. Also, you have something that we don't have a paper for, but it's called neutropenic isolation, and that's reverse isolation. So that's where your patients that are immunocompromised from the oncology floor, they may have cancer or something, you would need to protect them from you. So you would gown up, gloves, mask, a gown, so that you don't give that patient anything that's potentially pretty sick. Okay, so starting off, we're going to verify the physician's orders. So you always want to check your orders first, and that's kind of going to tell you what you need to do with that patient anyways. So when you're seeing what assignment you have in what area, always check your physician's orders, go to the patient's room, review the patient's chart, and then after you see what type of PPE you're going to place on, you're going to knock on the door and introduce yourself. Hello, Mr. Smith. My name is Harvey. I'm with the respiratory department. I came here today to do a physical assessment on you. Is it okay if I do that assessment? Always get the patient's permission. Don't just assume that it's okay for you to go over and start touching a patient. You have to get permission for anything you do to a patient, anything you give to a patient. With that said, the patient also can refuse anything. So if the patient says, I don't want you touching me, get out of my room, you have to leave. Okay, so let's pretend Mr. Smith's fine with me doing everything. So Mr. Smith, I'm just going to do a little bit of assessments. I'm going to wash my hands, make sure that I come in. I'm going to go ahead and do a few things with you. So I'm going to have to position you. So I'm going to sit you up a little higher so that I can work with you. Okay. Now I'm going to look at your chest. So I want to, when you're going to do vitals and you count respirations, you don't necessarily want to tell them because they might control the way they're breathing. But in this instance, I'm going to look for respiratory rate and pattern. So I want to make sure that the breath rate is equal bilateral. You see good chest rise and movement. If you see anything out of the ordinary, like one side higher than the other, you would need to inspect that. You also want to check Mr. Smith's work of breathing. So is he using accessory muscles? Does he look like he's having a hard time? Is he struggling to get words out to you? Is he making sense when he's talking to you? Okay, these are some of the things you can even do before you even touch him. Just walking in the room, getting close to him. I can see how he's breathing. I can see his work of breathing. I can see his demeanor. I can see his skin color. I can see if he's diaphoretic. So there's a lot. Just by me talking to him, I can kind of get a feel for his mental status too. So if you're checking mental status, we want to do what's called ANO times 4. So that's alert, an oriented person, place, time, and event. So if Mr. Smith tells me that John F. Kennedy is the president of the United States, we know he doesn't have the right year. And if he can't tell me where he's at, we know he's not alert to that. So we would mark off deficits for anything that Mr. Smith does not have. So if he's alert to everything except the time, that's the only thing we would take off, and we would say ANO times 3. Now Mr. Smith, I'm just gonna turn you on your side a little bit. You can always ask them to help you, and Mr. Smith can kind of turn himself, or if he's not able to, we can actually help him. If you're gonna do this, you wanna lower the bed a little bit to make it easier on yourself. Of course, I have gloves on, I have all the PPE necessary. I am just doing this for demonstration purposes. So I am gonna turn Mr. Smith towards me so that we can see his back. So Mr. Smith, I'm going to have you come towards me, and I'm just going to take a quick look at your back. If it's hard for us to do this by ourselves, watch his face, don't let his face hit the rail. You can always ask for help. So all I want to do is check his spinal column, make sure there's no deformities, make sure there's no decubitus ulcers like bed sores or anything. Want to make sure it's straight. We're looking for like kyphoscoliosis or any type of deformities he might have, because that will in effect affect his breathing. So along with the spine, we're looking at his chest diameter. Is he barrel chested? Do we notice any kind of differences? So if you do have to expose his chest, always ask to. Don't just lift up a person's shirt. If it's a female patient, of course you're going to take into consideration, be modest, ask everything. Don't move a person's gown or anything. We're going to look at the fingers. So when you check the fingers, we're looking for what's called digital clubbing. There is the fingers will be really rounded like golf clubs. The fingernail bed will be circular in shape. And I don't know if it shows it in your textbook, but one of the things we learned in school when I was in school is to look to the two fingers together. And if you see that diamond pattern, you don't have digital clubbing. If you don't see the diamond pattern in there, you may have digital clubbing. All right, so after digital clubbing, we're going to palpate the chest. So when you palpate the chest, again, be modest, be considerate about any kind of things the patient might have as concerns. If they don't want you to touch a certain area, be mindful of that. Mr. Smith, I'm just going to feel your chest, see if there's any pain, any discomfort. You're just going to feel, look for tenderness, any kind of abnormalities you would feel or anything on the chest. Okay? So for tactile fremitus, you're going to ask the patient to fold their arms across their chest, like so. Then you're going to palpate the chest, and when you palpate the chest, you're going to have the patient say either 99, 99, or egopnia. Depending on the different areas, you may feel some different vibrations, and that could be indicative of possibly a pleural effusion or some other type of abnormality. Next, we're going to feel the patient's throat. And what we're feeling for is tracheal deviation. So you're going to take your fingers, and usually I like to just feel the side or the other side. And if you notice that the trachea is to one side, that can indicate a pneumothorax. So we will have different reasons for the pneumothorax. There could be a tension pneumothorax or just a regular pneumothorax. But if there is some type of deviation of the trachea, be aware that that may indicate some type of issue, because normally it should be midline. We are going to ask the patient if they can produce a sputum sample. If the patient can cough up a sputum sample, we will give them a cup to do so. If they cannot, we can help them. We can suction, or sometimes the doctor will order a medication and have you induce the sputum, so sputum induction. If you do that, always make sure that you have a bronchodilator, because the sputum induction can cause bronchospasm, and we wouldn't want that to happen to the patient, so you want to reverse that. Okay, so now you want to make sure that if you moved anything, if I put the rail down, if I took anything off, I put everything back the way it was. I thank Mr. Smith for everything. I make sure everything's safe. I make sure he's comfortable. I offer him the rail. Make sure your rails are up. I'm sorry, I was looking at something. Make sure you give him the call light. That's a big thing for me. Don't just assume that this patient can reach the call light if it's up here, and just don't assume that he knows how to operate it. Also, you want to give it to him. Mr. Smith, here's your call light. Is there anything else I can do for you, or would you like me to do something before I leave? yes he does or no he does. And a lot of times they might ask you to just close the door behind yourself, so you would ask him, should I close the door behind? Or he might want you to fix his pillow, or he might want you to get his nurse. So thank you very much, sir. I appreciate everything. You have a wonderful day. Come over here. I'm going to clean my hands with my hand sanitation, and then now I'm going to go chart everything.